Now to the latest on the pandemic as the coronavirus continues to spread rapidly across the U.S. According to Johns Hopkins University, the virus has infected more than 6.9 million Americans and claimed over 201,000 lives. In a Senate hearing on Capitol Hill yesterday, Dr. Robert Redfield, the director of the Centers for Disease Control and Prevention, warned the nation that most Americans are still at risk of contracting COVID-19.
CDC is in the process of a very large sequential study across the entire United States measuring serology. As I mentioned, the preliminary results on the first round show that a majority of our nation, more than 90% of the population, remains susceptible.
Emergency medicine physician Dr. Uché Blackstock joins us now to provide some insight into the latest that we are learning about this virus. You are a Yahoo News medical contributor and founder of Advancing Health Equity. So, doctor, a massive genetic study out of Houston shows that the coronavirus is mutating and potentially evolving. Just how significant were these mutations? I know, as I understand it, we had already learned that there were sort of different strains of it, if you will. So what could this mean for a vaccine, though, if it's mutating?
So actually, it doesn't really have much of an effect on vaccine. What this study showed was that the strain is actually more contagious, so it's likely to be more infectious, not necessarily more deadly or lead to more hospitalizations. So what this tells us is that we really have to keep using those basic preventive public health measures, washing hands, physical distancing, and even though many of us are getting fatigued as we go through the pandemic, what this research shows is that we still have to enforce those measures that we know actually work.
Specifically, I guess, doctor, because if you were watching that hearing yesterday, the nation's top doctors said at one point that 90% of Americans could still become infected with COVID-19. 90%. That is an astounding number where we are 6 months into this pandemic.
Absolutely. And, we've already seen 200,000 people dead. And if 90% of the population hasn't been infected, then you can imagine if we don't enforce those measures. To reach herd immunity, you need about 60 to 70% of the population to have antibodies or to have been infected and generate antibodies. Unfortunately, we can't do that the natural way because too many people would die. Instead, we're going to use a vaccine to do that. And that's why we need to have a safe and effective vaccine.
So I thought this was very interesting because in our discussion about vaccines and testing in the various phases of testing, there's been a real concern that there are not enough minority candidates who are willing to sort of get involved in helping to vet these vaccines. So a group of Black physicians has created their own expert task force to independently vet COVID-19 drugs and vaccines. This has been organized by the National Medical Association, which is, meant to safeguard against any unscientific guidance from the CDC and the FDA. But what does this say about not only the underrepresentation of minorities in COVID-19 vaccine trials and studies, but also the trust that the public has in these health organizations?
Yeah, I think this just shows just what an unfortunate moment we're in right now, where the public really does not trust, our agencies that have been typically and historically well trusted, the CDC, the FDA, and especially we know because of historical occurrences that Black communities and other communities of color have a higher level of mistrust towards healthcare and medical institutions. And so I think that it's great that the National Medical Association, which is the oldest and largest Black physician organization, took it upon themselves to say, we're going to vet this data and to make sure that our community members have the information they need to make an informed decision.
All right, Dr. Uché Blackstock, important information for our viewers. Thank you so much for joining us. We appreciate it.
Thank you for having me.